temperature changes throughout the day. This tends to be a classic case is we start to get tired around 3 o'clock in the afternoon. Want to take that mid-afternoon nap, but we really need to keep going. That's one of the things. And when we start to have blood sugar regulation, we have a hard time really staying on track, putting our day in order, or we just forget things very simple. PCOS, polycystic ovarian syndrome. This is usually not diagnosed until late stages when a woman has a lot of pain in the uterine area during periods. It can also just happen when we start to see excessive flow. With men, there is erectile dysfunction that can show up with metabolic syndrome. Obviously, everybody knows about the cardiovascular diseases. Seems to be associated with more of the abdominal visceral fat. Dyslipidemia, abnormal blood cholesterol, hypertension, sorry that got knocked off a little bit. Osteoporosis. Notice that's on there with the metabolic syndrome. Fat bone. Obesity, sleep apnea. Sleep apnea is very, very misunderstood. I would dare say in the medical community, it's just don't know how to fix it. We just get a CPAP machine and go from there.
It's not a CPAP deficiency, folks. It isn't.
Not at all.
No.
Has a lot to do with how your body is regulating blood flow. If you're getting enough oxygen in your system, and sleep apnea means we have to, at night is when the time that you heal. When you sleep, you heal. So those of us that cut our sleep time short, we're also cutting our body's time of healing. So it's important to have a healthy sleep cycle. When the sleep cycle is off, we're letting ourselves go into that preemptive state of metabolic syndrome.
Metabolic syndrome is huge, and it's it seems to have its fingers into everything. And I can't say enough about it, except when we put our patients in lifestyle therapy to change the way they're eating, the way they're exercising, the way they're dealing with stress, the way they're sleeping, and just really incorporating all the things that we know are affected. Blood pressure pills get dumped. Their cholesterol pills get dumped. Their foot problems that they might have due to too much weight, no more orthotics. I can just go on and on what it all does. Rashes disappear. Chronic allergies disappear. It's all connected to all this insidious inflammation. All of a sudden, their moods improve tremendously. And it can all happen, and you can feel it happen in a matter of just a few months. It doesn't take a lifetime to change these things. So that's always really encouraging. So autoimmune disorders is on the rise. It's become an epidemic. We feel it's getting to be close to 80% of all disorders now. We have well over 100 at last count. When I was going to school, there was 8. Yeah, it's absolutely amazing how it's just exploding. Eczema, it's an autoimmune disorder. Crohn's, that's a classic one. MS, Parkinson's. There's so much of it out there. Alzheimer's, diabetes, all these are autoimmune disorders. And why are they on the rise? Why is it just exploding? And why aren't doctors doing much about it? Well, it's because one of the reasons is only 10 to 20% of medical education gets spent on chronic disease. Most of it's on acute disorders. And you know what? We're very good at it. Yeah, we're very good at it. But again, 80% of our disorders are chronic. So we're finding that we have a very interesting phenomena that's common to all autoimmune disorders, whether it's eczema, or diabetes, or Crohn's, or MS, Parkinson's, and that commonality is a Th2, this is a white blood cell, predominance. It's an imbalance in the immune system. We have different T cells. You might have heard of T cells. They're white blood cells that are fighters. T1 is good for bacterial infection. T2 is more viral. Bacterial and viral is T1. We have anti-tumor. We have just all these different T cells. There's T3, T4, T5. T2 is the one that recognizes environment. And we have found that if T2 gets too high, that all of a sudden it hits a certain area up here, that it becomes what we call self-propagating. It spins out of control. There's nothing to break it down to normal levels anymore. And it starts spiraling upwards, depressing all the other ones. You become more prone to catching cancer, bacterial infections, viral infections. This T2 disorder is very, very prominent in autoimmune disorders, and we now have ways to get it back down to normal. In this office, it's just utilizing something called perilla seed. Paramin is the trade name. It's been in use for thousands of years in China. Thousands of years. They know it's good for asthma, they know it's good for eczema, they know it's good for chronic inflammatory conditions. The Japanese, about 12 years ago, started researching it, figuring out how did this work. They figured out it suppresses T2 cells to normal levels, and once it's normal, everything is normalized. And it's now known as a drug in Europe because they can patent drugs that are natural substances. Here you can't, luckily, and it's just a natural supplement over here. This is a huge weapon in the fight against autoimmune diseases. But now we also know that we can utilize fish oils to help normalize inflammation as well. And we utilize between 3 and 8 grams of EPA a day, EPA being the most effective by far. I know there's a lot of EPA DHA out there. Ours is an Australian product because there they have put a special coating on it so it gets released right where I want it. And it's called Max EPA here. Our data shows for the first time that the prevalence of autoimmune disorders and celiac disease, gluten sensitivity, is related to the duration of exposure to gluten. You want to hit that one?
Sure. I guess the easiest way to really explain how this is something I would say I would learn from my own experience. And it's not like, mine would not be the gluten, mine would be the dairy. My parents found out when I was very young that I was a colic baby, and I could not tolerate milk. Well, as all parents do, they tried it again, I seemed to tolerate it better, and said, oh, I just grew out of it. Well, as I got older, my hormone cycles were bad, I had bad breakouts, I would double over. On the first 2 days of my cycle, I couldn't go to school. I spent all my day like this over my bed, or like this over my bed, trying to figure out the most comfortable thing to do. Nothing touched it. Ibuprofen didn't hit it. And the longer that I had this problem, the less the symptoms showed up. The more I ate dairy, the less the symptoms showed up. Ice cream was always bad because it always gave me a headache. Well, took myself off dairy. Everything cleared up. My hormone cycles got better. My face got better. My mood improved. Oh my gosh, my parents were excited about that. I was a bear. And then I found out after I reintroduced it, I thought, well, let's try it. Let's really see if this was truly the problem. I was doubled over in pain for 2 hours. Like somebody was stabbing me in the gut every 30 seconds as it came through my gut. And I was like, okay, how long is this going to take to heal? I've been eating over 30 years. How long do you think it would heal? My cells don't heal overnight. My intestinal tract was chronically inflamed. So same thing here. And this is one of the reasons that I'm a stickler with my moms during their pregnancy and what they feed their children. That I believe the first 2 years, if you hold them off gluten, you're better off to have a healthier child. Because I know that if I can keep the gut healthy for the first couple years of life, if we add the gluten in when it's the time where we have the most digestive enzymes, the best bacteria in there, you're less likely to have this gluten sensitivity show up. Whereas if we start it too early, like I was started on milk, that my gut never got a chance to proliferate and grow and be healthy. So same thing is going on here. The longer that we're exposed to it, sometimes the sensitivity doesn't show up until you take it out. And then it comes back with a vengeance for some.
72% of us carry the gene for gluten sensitivity. That was released just a couple of years ago. 72% of us. And given the right circumstance, the right stresses, the antibiotics, for instance, or some sort of pharmaceuticals, or stress in life, that can activate that gene, and all of a sudden you've got issues with it.